When we take the terminology description with respect to cardio, neuro, gastro, the disease entity related to nephro are somewhat confusing. MD resident many a time get confused with this terminology, and especially Harrison, the definitions were not clear, like acute glomerulonephritis, nephritic syndrome, rapidly progressive renal failure, even rapidly progressive glomerulonephritis, CKD. So these are some terminologies where students are getting bit confused. In this video, we are going to see that. Since I am not using any PPT, let me go very slowly with some examples. If we take the nephrological syndromes, that can be classified based on 3-4 parameters, like function of the kidney, how much function loss is there. Based on that, we can use the terminologies. For example, chronic kidney disease, acute kidney injury. These include both duration and the functionality. Acute means short period, chronic long period. Second one, based on etiology, we can classify. Third one, based on the main pathological issue, what is going on, that we can classify. So if a particular disease is being described under this category, the students might get confused. Let us take only these three one by one. First, let us take nephritic syndrome. What is this nephritic syndrome? It is nothing but inflammation of the glomeruli, which leading to the clinical manifestation. Nephritic syndrome. First one, inflammation of the glomeruli. But most of the textbook, if you take, they always start with it is a syndrome characterized by hematuria, edema, mild proteinuria. Yes, these are the manifestation. The symptoms are there. Basically, there is an inflammation of the glomeruli. That is what it represents. Is it a separate entity? No, it is not a separate entity. Nephritic syndrome, any etiology causing inflammation of the glomeruli comes under nephritic syndrome. What are the etiologies that can cause? For example, SLE can cause nephritic syndrome. Systemic lupus erythematosus can cause. IgA nephropathy can cause nephritic syndrome. Prototypical example is post-infectious glomerulonephritis. Previously it is PSGN, post-streptococcal glomerulonephritis. That can cause nephritic syndrome. In many a textbook, even these kind of coaching center related textbook, under the nephritic you might get this post-streptococcal glomerulonephritis only. Nephritic syndrome etiology can be anything. Most commonly traditionally we have described a post-streptococcal glomerulonephritis. The name itself says post-streptococcal glomerulonephritis. It is an inflammation of the glomeruli. Okay, nephritic. Apart from ANCA, ANCA associated disease can cause. Any etiology can cause. Hepatitis B, C can cause. So any inflammation, if I describe it basically as pathological wise, nephritic syndrome. Shall I name it as glomerulonephritis? Yes, that is also correct. Acute glomerulonephritis, if it is occurring all of a sudden. If that particular etiology is for a long period of time, let us take it as 3 months, it is called as chronic glomerulonephritis. Nephritic syndrome, acute, you can say at acute nephritic syndrome also, chronic nephritic syndrome also. Other name, acute glomerulonephritis, chronic glomerulonephritis related to nephritic. Does IgA nephropathy causes? Yes, it can cause acute glomerulonephritis or nephritic syndrome. Here I am using the terminology based on the main pathological focus only. Suppose if I use the functional component, if creatinine is raised, yes, I can say it as acute kidney injury if it is of short duration. If it is of long duration, I can say it as CKD. So these terminologies are not different. For example, if a patient is having SLE related renal dysfunction, it can be called as AKI because we are describing it as functional wise short duration. If I want to describe it pathological wise, as nephritic syndrome can be used. If I want to use the disease per se itself, SLE, lupus nephritis can be used. See, the terminologies are a bit confusing, at least for the medicine resident, but this is how the subject is. But once you understand this being described based on particular subparameter, function or pathology, you will easily understand. So I hope nephritic you got a fair amount of idea. Since PPT is not there, let me give one more example. Let us take post streptococcal glomerulonephritis. Patient presenting all of a sudden. I can label it as typical PSGN. Yes, that is what we usually describe. But post streptococcal glomerulonephritis, is it a inflammation? Yes. So it is nephritic syndrome. Is it causing renal dysfunction? If creatinine is rose, yes, you can label it as AKI. AKI, acute kidney injury. The etiology is PSGN. Okay. Suppose if the person doesn't improve, the pathology maintained for a long period. Let us take 6 months, there is no recovery. Let us take 90% PSGN recovers, at least for this discussion. Let us take it didn't improve for some or other reason, patient didn't take proper treatment, okay, it didn't improve. You can label it as chronic glomerulonephritis, or the functions of the kidney is little bit lower down or lost. You can label it as CKD, chronic kidney disease. Etiology being chronic PI, post streptococcal glomerulonephritis, or chronic glomerulonephritis. The terminology, I hope now you understand. CKD based on the function. Chronically glomerular inflammation is there. That is why chronic glomerulonephritis. I hope a fair amount of idea you might have got how these terminologies are used. Now coming to the other terminology, rapidly progressive glomerulonephritis. It is again inflammation of the glomeruli, but function is losing rapidly. Just a play of terminology. For example, the same patient with SLE, IgA nephropathy, creatinine is jumping from 2, 4, 6, 8. It is rapidly worsening. You can say AKI, 7 days less than. More than 7 days, it is about to go into CKD. After 3 months, the chance of recovery is less. So what is happening? This glomerulonephritis inflammation is rapidly worsening. That is why it is called as rapidly progressive glomerulonephritis. So kidney glomeruli is one component. Other components are tubule, interstitium, vessels are there. We are seeing only the glomeruli. Other three components are there. So above this, what is the category? Rapidly progressive renal failure, under which these four comes. Most common is rapidly progressive glomerulonephritis. That is why in many textbooks under RPRF, rapidly progressive renal failure, you might not get the description, you will get directly as rapidly progressive glomerulonephritis, the text I am saying. Because it is common, that is why they are mentioned. But other components are also there that might be involved. So what they want to tell here is the functionality. Function is rapidly losing. So this is what it is. So nephritic or inflammation of the glomeruli or glomerulonephritis, all three are correct. So function is losing more rapidly, we will say is rapidly progressive glomerulonephritis. Function lost more than 3 months, we will call it as CKD, chronic kidney disease. What could be the etiology under which chronic glomerulonephritis comes? So that's all regarding nephritic and RPGN and acute glomerulonephritis. Etiology wise also you can describe. For example, if we come to notice IgA nephropathy, yes, IgA nephropathy can present as AKI, can present as RPGN, can present as CKD. Net, we will come to the summary. I hope 2 or 3 examples I have given. If you still have any confusion, do let me know. I will try to make with the help of a PPT so that your understanding will be a bit better. In summary, the nephrological condition can be described based on duration and functionality, based on the main pathology, inflammation or protein is leaking, like that. Third one is etiology. So these three don't sway away because of the disease condition. Why? Because we got a doubt last week that student was saying the patient is having nephritic syndrome. I asked, is it lupus nephritis? They were like, no, sir, the diagnosis was made. It is only nephritic, it is not AK, it is not CKD. It's a interconnected concepts. Basically, all why we are doing the terminology, because we can focus the treatment over there. Because if we are not focusing the treatment over there, whatever the name it is, it doesn't matter. Why we are naming it? We can focus on the reversible factor. We can focus on whichever is rapidly worsening, those things. That is why the terminology is. And I hope in the text, after seeing this video, if you see the text, you will get a good amount of idea regarding the syndromes that you are going to study. So bye bye, that's all for today. In the next video, we will see regarding probably any one of this particular heading, we will see in detail. Bye bye.